Hello, my name is Adolfo Ascencio and I'll be doing my presentation on Calcitriol. As a brief introduction, Calcitriol is a hormonally active synthetic vitamin D analog that is prescribed to treat hypocalcemia, osteoporosis, and the prevention of corticosteroid-induced osteoporosis. Um, it is also used to prevent and treat certain types of calcium, phosphorus, parathyroid problems that can happen with long-term kidney dialysis or hypoparathyroidism. Calcitriol is usually used also along with a specific diet recommendations and sometimes other medications in conjunction. Calcitriol is an active metabolite of vitamin D with three hydroxyl groups. It is produced in the body after a series of conversion steps of 7-dehydroxycholesterol from exposure to UV light. Calcitriol is the active form of vitamin D and is essential for calcium absorption and bone mineralization. Calcitriol, which is actually the most active form of vitamin D. Um, we first thought calcitriol was to be generated slowly in the kidney, but is now recognized in many extrarenal tissues as well. For the pharmacokinetics of calcitriol absorption, the peak serum concentrations following a single oral dose of 0.5 to about 1 micrograms were found within 3 to 6 hours. The serum calcitriol levels reached a steady state within 7 days. For distribution, after a single oral dose of 0.5 micrograms, the average serum concentration rose from a baseline of 40 to 60 after 2 hours. For its metabolism, calcitriol is metabolized in the liver to hydroxy metabolites. When circulating concentrations of the metabolites are adequate, further hydroxylation in the kidney occurs. For the excretion, its half-life of calcitriol is 9 to 10 hours. For its mechanism of action, systemically, calcitriol binds to the vitamin D receptors in the kidneys, parathyroid glands, intestines, and bones to increase serum blood calcium levels by promoting absorption in the intestines, renal tubular reabsorption in the kidneys, and release from bones. Along with the parathyroid hormone, calcitriol stimulates bone reabsorption and by activating osteoclasts through the release of receptor activator of nuclear factor kappa B ligands, also known as rank L from osteoblasts. Calcitriol significantly also inhibits the proliferation of normal human epidermal keratinocytes and T lymphocytes by inducing apoptosis. It also does it by inhibiting gene expression of relevant chemokines and epidermal proteins involved in psoriasis. So, as indicated earlier, calcitriol is a hormonally active synthetic vitamin D analog. It is usually used to treat forms of hypocalcemia, osteoporosis, and the prevention of corticosteroid-induced osteoporosis. Systemic calcitriol is FDA approved, specifically to control hypocalcemia in patients with chronic renal dialysis, secondary hyperparathyroidism in those with chronic kidney disease not yet on dialysis, and hypocalcemia in patients with hypoparathyroidism and pseudo-hypoparathyroidism. In 2009, the FDA also approved a topical calcitriol ointment, and this is for the management of mild to moderate plaque psoriasis. There are some off-label uses for calcitriol. This usually includes type 1 vitamin D dependent rickets and pseudo-vitamin D deficient rickets. Sometimes the off-label use for the topical ointment also can be used for psoriasis in children and adolescents. For the treatment of hypocalcemia and secondary hyperparathyroidism and resultant metabolic bone disease, so this is renal osteodystrophy in patients with chronic kidney disease, the oral dosage for adults is 0.25 micrograms by mouth daily initially, and you can increase that all the way up to 0.5 micrograms per day if necessary. For children and adolescents 3 to 17 years old, it is essentially the same dosing as the adults. The only time it varies slightly is from the infants and children 1 month to 2 years, and that'll be a dose of 0.01 to 0.015 micrograms per kilogram per dose, and that is also once daily, and you can increase the dosage as necessary, just not to exceed more than 0.5 micrograms per day. For the treatment of hypocalcemia and secondary hyperparathyroidism and resultant metabolic bone disease, for renal osteodystrophy, but this in dialysis patients, we do a dose of, for adults, 0.25 micrograms by mouth daily initially, and increase the dosage by 0.25 micrograms daily every 4 to 8 weeks if necessary. Patients with normal or slightly reduced serum calcium concentrations may respond to doses of 0.25 micrograms every other day. Most patients undergoing dialysis respond to 0.5 to 1 micrograms per day. For the intravenous dosage for adults, usually started off at 1 micrograms, or if you're using weight-based dosing, 0.02 micrograms per kilogram to 2 micrograms IV 3 times weekly, approximately done every other day. Initial doses of 0.5 to 4 micrograms IV 3 times weekly have been used. They may increase the dosage to 0.5 to 1 micrograms every 2 to 4 weeks if necessary, based on their parathyroid hormone concentrations. For the treatment of patients with post-surgical hypoparathyroidism, idiopathic hypoparathyroidism, and pseudohypothyroidism, parathyroidism, manifesting as hypocalcemia. For adults, 0.25 micrograms by mouth daily initially, and increase the dosage every 2 to 4 weeks if necessary. However, the usual dose is usually 0.5 to 2 micrograms per day. And then essentially for children and adolescents, it's the exact same dosage and titrated the exact same way per every 2 to 4 weeks with the same usual dosing. And then also for children's 1 to 5 years old, it's essentially the same thing. The only time it changes is from neonates and infants, and this is usually dosed at 0.25 micrograms by mouth once daily. For drug interactions, it has very minor interactions with some medications, nothing very significant, but usually seen with these kind of products, such as like calcium products, cholestyramine, corticosteroids, digoxin, ketoconazole, magnesium supplements, phenobarb, phenytoin, phosphate binding agents, and some antacids and thiazide diuretics. These are just very common examples of medications that interact with it, and definitely not limited to others. For monitoring, you want to monitor parameters such as the serum calcium, creatinine, BUN, the PTH, and phosphate. Specifically during titration periods, all patients must be monitored with serum calcium levels at least twice weekly, according to the KDIGO 2009 guidelines. The corrected total serum calcium and phosphorus levels should be in the normal range for all stages of chronic kidney disease or patients that have CKD. For monitoring, once again, if hypercalcemia develops, the drug is discontinued immediately until the serum calcium levels normalize, at which the point treatment can then resume at a lower initial dose. For dialysis patients, serum calcium, phosphorus, magnesium, and phosphatase must be monitored periodically. If hypoparathyroidism patients, serum calcium, phosphorus, and 24-hour urinary calcium levels must be monitored periodically. In pre-dialysis patients, serum calcium, phosphorus, alkaline phosphatase, creatinine, and PTH are compared at baseline, then monthly for 6 months. Therapeutic effectiveness requires a minimum of 600 milligrams of calcium intake daily, and the recommended dietary allowance for calcium in adults being 800 to 1200 micrograms. For some warnings, there is a close correlation between treatment with calcitriol and the development of hypercalcemia, and then also increasing the inorganic phosphate levels in serum. As for adverse effects, usually seen in late-stage calcium toxicity, so this is usually for asymptomatic patients who don't necessarily show any symptoms of hypercalcemia. Usually results in changes in urine, loss of appetite, light sensitivity, chest pain, and racing heart. Some people can have allergic reactions, and this is not limited to itching, rash, hives, swelling of the lips, such as angioedema. Sleepiness, frequent urination, weight loss, increased thirst, and itching seem to be more of the minor side effects of this medication. Some clinical pros for this is for the treatment and prevention of vitamin D and calcium deficiency. It is used as an adjuvant for treatment and prevention of osteoporosis and bone disorders, as a supplement when vitamin D requirements of the body are high, such as in the elderly or inadequate sun exposure. It plays a crucial role in the absorption of calcium and phosphorus, which is critical for the formation, growth, and regeneration of bones. And here are my references. Thank you.